reality technology, he could perform Susan's operation on a computer before ever entering the operating room. Could this technology help him fashion a face for Susan that the world wouldn't reject?
I did not think that we can make Susan look like a normal person, but I think we could make Susan be able to walk down the street without people pointing fingers at her.
No doctor had ever had the confidence to offer her this much hope. Susan was completely unaware of the development of space-age technology that might help in complex cases like hers. In the years leading up to her meeting with Dr. Stephanides, NASA had teamed up with Stanford to design sophisticated 3D imaging and virtual reality programs that could be used to respond to medical emergencies on future long-term space missions where the nearest hospital might be light years away. The medical challenges that might be faced on a mission to Mars, NASA turned to the expertise of Stanford Medical Center and a team of physicians led by surgeons Stephen Schendel and Michael Stephanides.
We're very surprised that NASA was interested in the surgical simulation. It was, I feel, twofold. The timing was right with NASA, and also they realized they needed this for long-duration spaceflight.
In 1997, the Stanford NASA Biocomputation Center was created. Former NASA computer engineer Kevin Montgomery joined the team to lend his expertise in designing virtual models for surgical planning. Using data from patients' MRI, CAT scans, and other photos, he developed sophisticated 3D images, such as this virtual patient.
So this system is a prototype system that we're developing for NASA so that a surgeon on their way to Mars would be able to maintain their skills by practicing on a virtual patient, but also use this system to perform a surgery and to have all the data that they need right in front of them right when they're doing the procedure. It's basically a heads-up display for a surgeon.
Such 3D programs might someday help save lives in space, but here on Earth, the technology was revolutionizing surgical planning.
Today we have pilots fly flight simulators before they fly planes without passengers, before they fly planes with passengers. In the future, surgeons also will be using computer-based surgical simulation in order to practice a surgery before they go into the operating room under the training of an expert surgeon, and certainly before they would ever be practicing on their own.
No longer would experienced surgeons have to rely solely on their artistic eye. These realistic simulations were making a critical difference in planning complex cases like Susan Wendell's.
The advantage of 3D surgery, or 3D imaging for the surgery, is that it allows you to visualize what you're going to do ahead of time. So you can sort of it's a mental exercise that you do before surgery, but it's visualized right there in front of you. It's like performing the operation once, twice, 3 times before you go in the operating room.
This pre-planning also lowers surgical risks and costs in the OR.
Saving every hour in the operating room is a few $1,000s. You're saving the patient anesthesia. Every extra hour of anesthesia is additional risk for the patient. You're saving the patient blood loss. Every extra hour in the operating room, you're looking at more blood loss. The incidence of infection goes up the longer the surgery.
Would this cutting-edge technology be enough to give Susan the confidence to place her future in the hands of a surgeon once again?